The social sector focuses on human capital development in order to ensure better chances of achieving the overall vision for families and the country by 2040. This include services that will further develop the people of Western Visayas and achieve human development, including improving the quality and delivery of health, nutrition, and basic education services, and improving quality and productivity of our human capital. The plan highlights taking advantage of the region's demographic dividend, or a condition in an economy when there are growing numbers of people in the workforce relative to the number of dependents as a result of declining fertility and improvements in old age population. The population of Region 6, based on the 2015 census, is around 7.5 million, growing at an annual average of 1.24% from 2010 to 2015. Poverty incidence among population was estimated at 22.4%. Infant mortality rate was 23.5% per 100,000 live births in 2015. Hypertensive cardiovascular disease continues to be the leading cause of mortality in the region, along with upper respiratory tract infection, remains the top cause of morbidity in the last 5 years, along with acute lower respiratory tract infection and pneumonia, hypertension, and diabetes mellitus. Region 6 has one of the highest incidence in teenage pregnancy and has risen to an alarming rate of 15% in 2015. The 2015 Food and Nutrition Research Institute survey revealed that 1 in every 4 children less than 5 years old are underweight. Among school children aged 5 to 10 years old, the prevalence of underweight and stunting were observed in 4 in every 10 children, while 1 in every 10 children are wasted or thin. Cohort survival rates in elementary education were reported at 93% and around 86% in secondary level. Completion rate were 92% in elementary and 85% in secondary education during the same period. Dropout rates have been decreased to only 0.5% in elementary and 1.8% in secondary education. The number of students enrolled in tertiary education increased from 282,313 in school year 2015-2016. In 2015, 47.7% of the students were enrolled in private higher education institutions. 46.5% were enrolled in state universities and colleges, and 5.7% were enrolled in local colleges. The number of certified technical vocational education and training scholars increased to 85.2% in 2015. Among the most vulnerable individuals are children, women, persons with disabilities, older persons, migrants and their families, workers in informal sectors, indigenous peoples, farmers, fishers, and families in coastal areas, residents in highlands and islands, and families living in high-risk areas, along riverbanks, mining areas, slopes, etc. As of 2016, Region 6 had about 129,727 indigenous people belonging to 2 ethnic groups, the Ati and Bukidnon. They are found in the islands of Panay, Guimaras, and Negros Occidental. About 96% of total households in Western Visayas are enrolled in the National Health Insurance Program. However, health manpower to population ratio remains below ideal standards. Combating communicable diseases need to be sustained, and health programs to address the leading causes of mortality, morbidity, and malnutrition need to be intensified. Despite considerable resources allotted to help the underprivileged, the magnitude of poor individuals and families still remain high. Added to this, the location of houses of these poor families are prone to landslides and other natural hazards. Informal settlers, on the other hand, are in constant threat of displacement due to demolitions to make way for government and private infrastructure projects. There is a need to generate more employment so that all those in the working age population will be gainfully employed. With higher working population and fewer people to support, Western Visayas can maximize the opportunity for rapid economic growth. Region 6 will enhance its human capital and increase access to social services through the following strategies: construction and rehabilitation or upgrading of hospitals, health centers, and laboratories, and expansion of the National Health Insurance Program, information dissemination and provision of responsible parenthood and reproductive health services, and intensification of information along communicable, non-communicable, and vector-borne diseases. The mental health program and the comprehensive rehabilitation and reintegration program for the drug surrenderies will be intensified, and activities to combat HIV/AIDS will be properly implemented. For education, search and hiring for qualified teachers to fill up plantilla positions will be intensified, and full and effective implementation of K-12 program. For quality of higher education and training for global competitiveness, improve the strategies include the following: provide further support to indigent and deserving students to access higher education. Highlighting courses responsive to industry needs will be provided. Job skills matching will be pursued, and access to higher education will be expanded. For productivity enhancement measures in industry and the workplace, productivity among workers and productivity measures in the industry and services sectors will be increased through regular trainings and capability building interventions for entrepreneurs, proprietors, management, and employees. Implement programs that encourage women to participate in the labor market. Encourage workplace harmony and safety and health in the workplace, and provide emergency employment, especially for those affected by shutdown of business and or retrenchment of workers. To reduce the vulnerabilities of individuals and families, the region will strengthen the collaboration and enhance convergence of efforts among agencies by regularly conferring with one another for the purpose of streamlining projects, avoiding duplication and overlaps, consolidating and rationalizing the use of government resources, creating awareness and appreciation of other agencies' ongoing and planned projects. Develop sustainable protection programs to reduce risk and vulnerabilities, such as social protection programs to better enable people to manage and cope with various types of economic and other risks to increase socio-economic resiliency. Strengthen implementation of labor standards and other working arrangements in companies. Improve financial inclusion and accessibility among vulnerable and poor families. Promote income diversification as safeguard to emergencies and threats of economic and natural shocks. Intensify implementation of solutions to reduce housing backlog and provide adequate transition houses and livelihood opportunities to disaster victims during the response, early rehabilitation, and recovery period. To increase the resiliency of individuals and communities, the region will identify vulnerable and susceptible areas to help identify appropriate resettlement communities. Regularly update the DRR-CCA enhanced plans. Improve the region's coping capacity from natural and human-induced disasters. Conduct regular disaster risk reduction management capability building trainings, and develop social safety nets in rebuilding disaster-stricken communities and areas in situations of armed conflict.
We continue to pursue our dream of a progressive Western Visayas region where people are prosperous, secure, healthy, happy, and conscientious towards of culture, heritage, and natural resources. So let us work together in shaping a bigger, better, and brighter Western Visayas. Iririmaw kaaten mga kabugtuan sa probinsya kang Antique, Aklan, Capiz, Guimaras, Iloilo kag Negros Occidental, kag sa syudad kang Bacolod kag Iloilo, maghugpong kita paadto sa sangka mapag-en, masulay kag mainuswagen nga pagpangabuhi para sa tanan.